Once we decide that surgery is the best treatment option for you, we connect you with a care team that includes not just the surgeon, but also a nurse coordinator and a scheduler. And we share a lot of information with you in terms of being able to contact the team and getting your questions answered. On the day of surgery, you will be required to come in about 2 hours prior to the actual surgical time. And once you check in, you're taken to a pre-op waiting area. This is where you will meet the surgical team, the anesthesia team, the OR staff, and everyone that's going to be taking care of you on the day of surgery and for the most part after as well. So this is where we will also verify a lot of the information and then make sure that you are set to go to the OR and address any of your questions or concerns. When you go into the operating room, your family will be shown to a waiting room. Once you get into the operating room, there are a bunch of things that are done. The anesthesiologist will, of course, first make sure that you're comfortable and asleep, and then get additional IV lines to be able to monitor your blood pressure and oxygen levels. And then we position you to be able to start the procedure. The actual procedure could be anywhere from less than an hour if it's just a wedge resection to 4 to 5 hours if it's removing the whole lung. Most times for a lobectomy, which is the most common procedure done for lung cancer, is about a couple of hours. And there is some additional time for positioning and anesthesia. But during this time, your family will be getting updates every couple of hours from the room to let them know about the progress and to give them a sense of how much longer is left on the procedure. When we're done with the procedure, the breathing tube most often is removed. You will be transferred to a recovery room where you will wake up, probably be a little bit drowsy and groggy. You will see that you have a chest tube, which is a tube that is placed in the chest cavity to drain the fluid and air that accumulates after surgery. And this is hooked up to a box that collects this fluid and air. You will be closely monitored for those first few hours, making sure that your pain is controlled and that you don't need any other extra medications. You are then transferred to a floor bed where you are continued to be monitored closely, but not so much in an intensive setting. It would be most times a regular floor bed. And this is where your family can come visit you. So usually about a couple of hours after the procedure is when you're in that room and you will be able to meet with your family and talk to them. The hospital stay typically for a lobectomy is between 1 to 3 days. Usually the first day after the surgery, we are able to check to see if the tube can come out. Once that tube is removed and your pain is controlled, you are ready to go home. Most times that's day 1 or 2. Sometimes it could be a bit longer. And that's something that we assess while you're inpatient. For a wedge resection, which is a smaller piece of the lung, a lot of times patients can go home the same day. The tube can come out in the recovery room. And if your x-ray looks good and your pain is well controlled, we could discharge you the same day. If there are any concerns, either in terms of just safety at home or just comfort levels of going home, pain control, any of these factors could mean that you stay a bit longer, but that is something that your care team will assess while you're in the hospital. During your stay, we will encourage you to be active, get up and out of bed, move around, use the incentive spirometer, which is a breathing machine which helps expand your lungs better. We will take care of your pain, make sure that your pain is well controlled before you go home. You will be seen every day and multiple times in a day by the care team. We will also have the physical therapist, the occupational therapist, and the social worker assess you to make sure that you are safe to go home and that everything at home is conducive to your being comfortable and safe at home. When you are ready to be discharged, we discharge you with detailed instructions on things to look out for, when to call your provider, things to be concerned about. And we also discharge you with a follow-up appointment. Typically, you see us back in clinic in about a week's time. This is where we will go over the pathology from the surgery. We will make sure that you are on the right track to recovery and answer any other questions that you have.